What is a gynecologist? A gynecologist is a medical doctor who specializes in the health of the female reproductive system. Gynecologists are trained to diagnose and treat a wide range of issues related to the female reproductive organs. They include the uterus, ovaries, fallopian tubes, and breasts. Gynecologists provide care for women from adolescence through menopause and beyond. Some of the common reasons women might see a gynecologist include routine checkups and preventive care. Gynecologists perform regular examinations to ensure the health of the reproductive organs. This may include pelvic exams, pap smears, and breast exams. Pregnancy and prenatal care. Gynecologists often provide care for pregnant women, monitoring the health of both the mother and the developing fetus. Family planning. Gynecologists can offer guidance on contraception and family planning options, including birth control methods and fertility treatments. Menstrual issues. Gynecologists address concerns related to menstrual irregularities, heavy bleeding, or other menstrual problems. Sexually transmitted infections, STIs. Gynecologists can test for and treat STIs. Gynecological conditions. They diagnose and treat various gynecological conditions such as endometriosis, polycystic ovary syndrome, PCOS, and uterine fibroids. Menopause management. Gynecologists can help manage symptoms associated with menopause, such as hot flashes, mood changes, and bone health. It's important for women to schedule regular checkups with a gynecologist to maintain reproductive health and address any concerns or issues promptly. It's recommended that young women begin seeing a gynecologist for routine checkups and discussions about reproductive health in their teenage years. What's the difference between a gynecologist and an OBGYN? The terms gynecologist and obstetrician-gynecologist, OBGYN, are related, but they refer to different aspects of women's health care. Here's the distinction. Gynecologist. A gynecologist is a medical doctor who specializes in the health of the female reproductive system. Gynecologists are focused on the diagnosis and treatment of conditions and diseases related to the female reproductive organs. This includes issues such as menstrual disorders, fertility problems, and gynecological cancers. Gynecologists may not necessarily handle obstetric care, pregnancy and childbirth. Obstetrician-gynecologist, OBGYN. An OBGYN is a medical doctor who is both a gynecologist and an obstetrician. Obstetrics involves the care of pregnant women before, during, and after childbirth. Obstetricians manage prenatal care, delivery, and postpartum care for both the mother and the newborn. Therefore, an OBGYN is trained to handle the full spectrum of women's reproductive health, from routine gynecological care to pregnancy and childbirth. In summary, while a gynecologist specializes in the health of the female reproductive system, an OBGYN is a medical professional who is trained in both gynecology and obstetrics, providing comprehensive care for women throughout their reproductive lives, including pregnancy and childbirth. Many women choose to see an OBGYN for their overall reproductive health needs because it covers both gynecological and obstetrical care. What is a urogynecologist? A urogynecologist is a subspecialist within the field of gynecology who focuses on the diagnosis and treatment of pelvic floor disorders in women. The pelvic floor is a group of muscles, ligaments, and connective tissues that support the pelvic organs, including the bladder, uterus, and rectum. Pelvic floor disorders can occur when these structures become weakened or damaged, leading to issues such as urinary incontinence, fecal incontinence, and pelvic organ prolapse. Urogynecologists have additional training beyond general gynecology to specifically address these pelvic floor problems. They may use a combination of medical, surgical, and rehabilitative approaches to manage and treat conditions such as urinary incontinence, involuntary loss of urine, which can occur with activities like coughing, sneezing, or exercise. Fecal incontinence, inability to control bowel movements, leading to involuntary leakage of stool. Pelvic organ prolapse, descent or sagging of pelvic organs, such as the bladder, uterus, or rectum, into the vaginal canal. Pelvic pain, chronic pain in the pelvic region, which may be associated with pelvic floor dysfunction. Recurrent urinary tract infections, UTIs, frequent and repetitive infections of the urinary tract. Urogynecologists often work closely with other healthcare professionals, such as physical therapists specializing in pelvic floor rehabilitation, to provide comprehensive care for women with pelvic floor disorders. Treatment options may include lifestyle modifications, pelvic floor exercises, medications, and surgical interventions when necessary. Women experiencing symptoms related to pelvic floor dysfunction should consult with a healthcare provider. And if needed, they may be referred to a urogynecologist for specialized care. What's the difference between a urologist and a urogynecologist? Urologists and urogynecologists are both medical specialists, but they focus on different aspects of healthcare related to the urinary system and pelvic health. Here's a breakdown of the key differences. Urologist. A urologist is a medical doctor who specializes in the diagnosis and treatment of conditions related to the male and female urinary tract and the male reproductive system. Urologists address a wide range of conditions, including urinary tract infections, kidney stones, bladder issues, prostate conditions, and male reproductive health concerns. While urologists do address some pelvic floor issues, their focus is broader and includes the entire urinary and reproductive systems in both men and women. Urogynecologist. A urogynecologist is a subspecialist within the field of gynecology who focuses specifically on pelvic floor disorders in women. Urogynecologists deal with conditions such as urinary incontinence, fecal incontinence, pelvic organ prolapse, pelvic pain, and other issues related to the pelvic floor muscles and structures. Their expertise lies in the female pelvic anatomy and the diagnosis and treatment of conditions that affect the pelvic floor. In summary, while both urologists and urogynecologists deal with aspects of urinary and pelvic health, urologists have a broader focus that includes both male and female urinary and reproductive systems. Urogynecologists specialize in the female pelvic floor and are specifically trained to address conditions that impact women's pelvic health. If a woman is experiencing issues related to the pelvic floor, a urogynecologist may be the more appropriate specialist to consult. Does a gynecologist deal with bladder issues? Yes, gynecologists can address certain bladder issues, especially those that are related to the female reproductive system or pelvic floor. The pelvic floor is a group of muscles, ligaments, and connective tissues that support the pelvic organs, including the bladder. Issues with the pelvic floor can contribute to various bladder problems. Common bladder issues that a gynecologist may address include urinary tract infections, UTIs. Gynecologists often diagnose and treat urinary tract infections, which can affect the bladder and are more common in women. Overactive bladder, OAB. Gynecologists may discuss symptoms of OAB, such as urgency, frequency, and urgent continence, as part of routine gynecological care. Pelvic organ prolapse. If a woman experiences a descent or sagging of pelvic organs, including the bladder, into the vaginal canal, a gynecologist may be involved in the evaluation and management. However, for more complex or specialized bladder issues, especially those related to urological conditions, or issues not directly tied to the female reproductive system, a woman may be referred to a urologist or a urogynecologist. Urogynecologists, in particular, specialize in pelvic floor disorders, which can include bladder-related problems such as urinary incontinence and pelvic organ prolapse. In summary, while gynecologists can address certain bladder issues, they may collaborate with urologists or urogynecologists for more comprehensive care, especially when the issues are complex or extend beyond the scope of gynecological expertise.